Hey guys, this is Dr. Hub. In case you haven't subscribed, please do subscribe. This is a concise, well-crafted summary and it highlights only the important keywords. Class sign. So class sign is nothing but a telescoping of the bowl loop. Clinical features, it includes a red current jelly stools. And it includes the Peyer's patches, that is a lymphoid hyperplasia. That is the lead point for interception in children presenting as a red currant jelly stools. The lymphoid hyperplasia is seen, that is the Peyer's patches. So outer intersusceptions, it is a recipient and the inner is interceptum. So outer is intersuscipiens, that is a recipient, and the inner is intersusceptum. Now investigation in case of the USG. The USG it includes, you can include the USG in children, that is a target sign. And next is the one bowel going to inside the outer. So target sign is seen, that is the pseudo kidney sign. Pseudo kidney sign is also seen. Then comes the sign in the barium enema, that is nothing but it is known as a class sign, or it is also known as a coiled spring sign. Class sign or the coiled spring sign. To learn and grow daily like this, please do subscribe.